In this video, we'll review radiologic imaging of the facial bones, including the correct CPT codes, commonly used diagnostic views, and a sample radiology report to support accurate documentation and code assignment. When coding for radiographic imaging of the facial bones, the two most commonly used CPT codes are 70140 radiologic examination, facial bones less than 3 views, 70150 radiologic examination, facial bones minimum of 3 views. The key difference between these two codes lies in the number of views documented in the radiology report. Use 70140 when fewer than 3 views are performed. Use 70150 when the study includes 3 or more distinct views. It's essential to read the radiology report carefully to determine the exact number of views performed, as this will directly impact code selection. Common diagnostic views for facial bone imaging include lateral view, PA Waters view, PA Caldwell view, AP modified Waters, PA reverse Waters view, axial modified Town, facial bones, zygomatic arch tangential, May method, bucket handle. The combination of these views provides a comprehensive evaluation of the facial structures and is often used to rule out fractures or other trauma-related abnormalities. Let's look at a sample radiology report to see how this translates into coding practice. Ordered exam, facial bones 3 views. Imaging views documented, PA Waters, PA Caldwell and lateral. History, injury. Comparison, none available. Findings, no displaced facial fracture is evident. No air fluid levels within the imaged frontal or maxillary sinuses. Impression, no displaced facial fracture. If there is continued concern for a clinically significant fracture, a maxillofacial CT scan is recommended. Since 3 views were documented, PA Waters, Caldwell, and lateral, the appropriate CPT code is 70150. In this example, the radiology findings are negative, so ICD-10 coding should reflect the reason for the exam, in this case, trauma. However, trauma alone is too vague for accurate ICD-10 coding. Always query the provider or refer to the ED or referring clinician's note if the documentation only says injury or trauma. Coders should investigate further to determine the specific type of trauma, such as fall, assault, or motor vehicle accident, and select the appropriate Z-code or external cause code. Always check with your facility's coding policy on how to handle negative radiology exams in trauma scenarios, especially when payer-specific requirements apply. Each institution may have its own approach to documenting and coding these encounters. A common ICD-10 code used in this situation is ZED043, Encounter for Examination and Observation Following Other Accident. This is used when the patient was evaluated due to trauma such as a fall, but no injury was found on imaging. Choose ZED043 only when no injury is found and the trauma is non-transport related. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.